Human resources for health crisis is one of the factors underlying the poor performance of health systems to deliver effective, evidence-based interventions for priority health problems. This crisis is more critical in developing countries. Uganda's health sector is still grappling with many challenges, including attracting and retaining health professionals, especially in upcountry communities. But with the ever-growing population, the country must source all ways of keeping its people healthy. The Health Ministry has since been working with village health teams to empower primary health care. Government, however, does not pay these community health workers for their effort. This meeting, held here in Kampala, was meant to disseminate the results of a research carried out to establish the relevance of community health workers. It is from the same meeting that the online registry tool would be launched.
So we need these people to reach the households, to educate them, the households, to follow them up, to refer, and to give guidance. And in some cases, to treat.
Dr. Paul Kagwa is the Commissioner for Community Health in the Health Ministry. In his address, he mentioned why there is need to monitor the village health teams.
So we need to look at what we call appropriate technology. What kind of people do we have? And who can we use and who is available?
Patrick Walimbwa is a community health worker from Mayuge district. He has been doing voluntary work at Malongo Health Center 3 for close to 15 years now. He was invited to this dialogue to be able to share his experience as a village health team member. On the sidelines of the meeting, Walimbwa told NTV what his role is as a member of the village health team.
The households distributing some drugs, for instance, which were neglected, which can treat neglected disease. This can is a part of, for instance, bilharzia, trachoma. That is, we are allowed to have that drug to distribute in the village. To conduct some community diagnosis, when you go there, you find someone who is just either bedridden or either suffering. You diagnose. After which you refer to the health facility.
We asked him what he thinks of the proposed registry for community health workers.
You know, I'm worried over this. They are saying that they want to put up or to register these VHTs. But most of them, they are going to be left out.
Walimbwa also says he has only been trained once during his entire career as a VHT.
We don't have tools for reporting.
Without tools to carry out his voluntary duty, Walimbwa says they also risk catching infections from the people they visit.
Because VHTs, you visit a person who has got TB, pulmonary TB, just or either extra. So now, when you breathe in that virus, it can be in you. You don't know when you suffer. Who can help you?
Working as a VHT requires one to move around households to ascertain the health issues affecting the community. Walimbwa says that's currently the hardest task he faces.
You put from my place up to the zone called Bwago. Just footing, it rains, and there is nothing where you have eaten. And from there you can even food. Then you reach home very late.
Although Walimbwa is not willing to give up his duty, his story is a typical one of the challenges that village health team members go through.
NGOs, for instance, these who gives us, they train us. For instance, as I told you, Iadra, it helped us. It could give us some T-shirts to identify. He used to give us some gumboots. At times it give us bicycles.
Dr. Kagwa says the ministry is aware of the incentives they receive from the partners.
We have never said that we don't motivate community health workers. No. We said salary no, but activity-related incentive.
He also used the occasion to rebuke the partners who execute their duties without following the laid-down protocol.
First of all, that money you get, is for Ugandans. It's not yours. Otherwise, you go and create your own country and mobilize money. You mobilize it on behalf of Ugandans. So let's find a way of working together.
Even when there is evidence showing that VHTs can add significantly to the efforts of improving the health of the population, the ministry feels many of them are doing the same work. Commissioner for Clinical Services, Dr. Jackson Amone, represented the permanent secretary, Dr. Diana Atwine, while reading from her speech. He said the government was agitated about the quality of work of the VHTs.
Has ever been a challenge of tracking what the village S teams do, where they are doing it, who they actually are, their level of education and basic competence, accountability to the national level, even to the districts where they operate, among others.
According to the ministry's plan, 15,000 community health extension workers will be trained. Each parish will then get 2 workers. But Walimbwa has his reservations about the plan.
My real village where I come from has got to 13. And the youth village is just a very large village, whereby one VHT or 2 VHTs cannot help. Don't you see? So what it means, at least, or maybe it could be just or to add on another one, another to be 3, I don't know. But it's not my command because that is government is what?
The Health Ministry has lined up activities to be achieved in the 2016-2017 financial year. These include complete development of training manuals, standard operating procedures, and implementation manual for community health extension workers. Identify and accredit training institutions for community health extension workers. Recruit and train 1,500 or 10% community health extension workers. Mobilize resources for rollout of the Community Health Extension Workers Strategy. Continue monitoring and supervising the VHT activities. The ministry, however, is left with about a month to have all these activities accomplished. Dr. Amone says this will only be done for accountability purposes.
To show the impact that the community health workers are having in the country. A community health worker registry is a good tool that captures and reports information on community health workers and can be used to inform evidence-based decision-making.
The recruited health workers will be deployed starting from the health center tools and will spend 40% of their time providing health services at the facility level and 60% of their time working in communities to promote health through the model family approach. The current VHTs who are interested and meet the criteria for selection into the community health extension workers will be absorbed and trained. VHTs who will not be absorbed will remain in their communities and continue to provide voluntary health services. Walter Mwesije, NTV.